sorry you don't have this handsome guy. You just get me today. Okay, so yes, I am Robert Young. Actually, I'm Robert B. Young, I'd like to note. I don't know how that happened. Robert M. is an anesthesiologist in Rochester, but he couldn't make it today. I am from Doctors for Responsible Gun Ownership. I'm the executive editor. Should you contact us either through the website or directly at info@drgo.us, I'm the one who almost surely will be the one replying, and we always do. Each one of you has our handout in your agenda package, which I thought was a good way to share the main points about who we are and what we do. That will not prevent me from going over it in agonizing detail, though. We are the doctors who know guns. And Tyler and the whole Second Amendment Institute, thank you so much for putting this on. I look forward to seeing it grow every year. DRGO is a nationwide organization of healthcare professionals and supporters who value honesty and human rights. Aside from me, our leadership includes Drs. Arthur Shabinda, the project director, John and Dean membership, Sean Brodale, outreach, and Dennis Petrocelli, our forensics expert, who is here. Dennis? All right. All right. We're nationwide. We come from all over. Our activities are all volunteer. We are all full-time medical practitioners. For 27 years, Doctors for Responsible Gun Ownership has been fighting the politicization of gun policy by know-it-alls in our profession. We base our positions on and educate others using the best data-driven science available. This consistently supports the benefit to the public health of American citizens exercising their right to keep and bear arms. We view our educational mission broadly. We've provided policy background and contributed to briefs in major cases like Emerson, Heller, Peruta, and Volschlager. We publish position papers by our experts on issues such as the health benefits of suppressors, the problems with medical records, and the dangers of emergency protective orders. We've testified before national and state legislatures across the country. And above all, our role is to share our expertise with anyone in the 2A community whom it can support. We advocate for the Second Amendment. I gotta do something different about this. Hold on. Okay, let's do it this way. We advocate for Second Amendment rights in written, broadcast, and online media. For example, Fox News, CBS News, National Review, The Washington Examiner, and many podcasts, and many other places. Basically anywhere we can, anywhere we get invited, we are there. We host a web blog, publishing new content every week, and maintain a vigorous social media presence on Facebook and Twitter, at least so far. And all that stuff goes through me. That's my job. We strongly object to the notion that doctors have any right to ask patients routinely about gun ownership. That's an ethical violation, an intrusion into your privacy, and constitutes malpractice if it leads to harm. We run a service at 2adoc.com, that's 2adoc.com, connecting gun owners with medical providers who support the right to keep and bear arms. That has turned out to be a very popular project. So now let's turn to DRGO's animating issue. The medical profession at large thinks it knows everything about everything. From gender identity to firearm safety, and now even on to climate change, all in the name of public health. Their problem is they don't know what they don't know. Learning how to diagnose and treat illnesses and to do surgery qualifies us only in those areas. Now, historically, public health interventions have been very important in preventing infectious diseases in populations. Authentic public health work has led to far more healthy lives and many fewer early deaths than any other human endeavor. Alongside this, developing medical treatments and preventive interventions has saved millions more lives. So why do doctors want to veer from this ancient and honorable lane? The truth is, most of us don't. Very few physicians want anything to do with the political goals of our professional organizations. That's why the American Medical Association now represents less than 20% of America's physicians, down from 80% some 50 years ago, when men were men, women were women, and doctors were doctors. But that leadership has become progressively more progressive as private practices have been swallowed up by institutions and physicians have to meet insurance requirements to get paid. These pressure providers to meet the agendas of those organizations, not just to serve the needs of their patients. And that, my friends, is the socialist, progressive approach of modern medicine. This goes back a long way. A top official at the Centers for Disease Control in 1989 announced they were, quote, going to systematically build a case that owning firearms causes death. The head of the CDC in the 1990s said that guns need to be seen as, quote, dirty, deadly, and banned, just like the activism against cigarettes. He sought, quote, a long-term campaign similar to those for tobacco use and auto safety to convince Americans that guns are a public health menace. Of course, firearms, like automobiles, used as intended, harm no one, though tobacco certainly does. Leaders of other specialty groups piled on. Now, these are all direct quotes. Guns are a virus that must be eradicated. Data on risks are not needed because guns have no redeeming social value. I hate guns. If I had my way, guns for sport would be registered and all other guns banned. The first salvo came in 1993, underwritten by the CDC and using questionable statistical methods in a study that claimed that a gun in the home increased residents' chances of being murdered by 270%. This is still widely quoted and even exaggerated. It's a primary example of the contortions that anti-gun researchers employ to scare people. This group looked at homicides in households from only 4 urban counties nationwide that were then suffering high rates of violent crime. They assessed the presence of guns in the household after the fact, often based only on neighbors' suspicions, and did not distinguish between guns that were legally owned, illegally possessed, or just found at a crime scene. Not one of the identified firearms could be proven to have been a murder weapon. This is the kind of rubbish that medical professions' anti-gun studies keep producing. And that applies to public health, quote, researchers too, which comes out of the medical profession, even if they aren't physicians. In 1994, DRGO's founder, Dr. Timothy Wheeler, testified with other experts before the House Appropriations Subcommittee responsible for funding the CDC. The result was the Dickey Amendment that forbids, not research, but the use of government funding to advocate for gun control, which is exactly what the CDC was doing. In 1995, Click and Gertz published their seminal paper showing that American gun owners used firearms in self-defense as many as 2.4 million times each year. In 2018, Click published a follow-up, having discovered that following his original study, the CDC surveyed people on the same question in 1996, 1997, and 1998. I wonder why. But along with many other surveys, since the CDC's survey confirmed Kleck and Gertz's original findings. But by the way, the CDC never published the results of their surveys. After many, many confirmatory surveys over the years, the latest one from this year suggests that 1.7 million is still a good estimate of the average number of DGUs each year in this country. Now, current CDC Director Rochelle Walensky wants to fund more gun-related research. Now, leaving her vocabulary mistakes aside about gun violence and gun deaths, we certainly hope so. But given the CDC's confusing advice about COVID management and even claiming the power to stop evictions as a public health intervention, expect that message to change capriciously. Many of us recall the, quote, assault weapon ban of 1994 to 2004. Since then, the DOJ's Justice Institute, the FBI, the National Academy of Sciences, and the liberal Rand Institute and others have all concluded there was no good evidence that it had decreased suicide, accidental shootings, mass shootings, or violent crime one iota. Yet the civilian disarmament complex wants to ban them again. In 2014 and 15, studies from the Johns Hopkins Bloomberg Center for Gun Policy and Research claimed that after Missouri ended universal background checks and became a shall-issue state, quote, gun homicides increased. They also claimed that when Connecticut instituted universal background checks and became a may-issue state, quote, gun homicides dropped. That was true. What they didn't report is that the very data included in those studies also showed that gun homicides in Missouri had already been increasing, then did so at a slower rate following the change there. Similarly, Connecticut's gun homicides were already dropping, but did so more slowly than before its change. Did you follow that? It's a little complicated. It's the trend that matters, not the absolute. Deceptive, manipulated, distorted, and not at all scientifically valid. Occasionally, we read decent research, even from ordinarily anti-gun sources, such as in 2018, UC Davis, which is now one of the state-funded anti-gun research institutions. Excuse me. Reviewing decades of California's comprehensive background checks, the most rigorous in the country, they had to conclude that these checks had no effect on California's rates of homicide or suicide using firearms. It's kind of amazing to see them even publish this. I will give them credit for that. And in 2019, DRGO member Mark Hamill published a study showing that nationwide, state concealed carry laws did not correlate at all with differences in homicide or violent crime rates anywhere. So why all the cries for universal background checks and all the fear of citizens bearing arms? Quality research has demonstrated conclusively and repeatedly that gun ownership in America is good for our public health. The best work comes from criminologists like Kleck, Gary Mauser, and others, and economists, such as my colleague, Dr. John Lott, Jr., of the Crime Prevention Research Center, which has done more to document the safety and importance of civilian gun use than anyone. We need to keep that coming. As some of us were chatting before, our side needs to find our own billionaires. Science is not a definitive oracle. It is a process that requires fair minds, openness to criticism, and the ability to change beliefs as research yields contrary data. These abilities seem sorely absent in the gun control industry. And in industry it is. Careers depend on getting funding from the Bloombergs and Soroses, their allied schools, foundations, and organizations, and the government, none of which value individual responsibility. It doesn't take a graduate degree or statistical expertise to see the faults in advocacy research. If you can read, you will find personal bias and cherry-picked data choices and interpretations. Correlations passed off as causation using irrelevant analogies and false attributions. Inanimate objects, firearms, treated as if they cause shootings or violence. Casting blame and vilifying anyone who disagrees. Irrelevant questions and straw arguments used as diversionary tactics. Requests for underlying data from other investigators being refused. And statistical significance purporting to have real-world importance, which it does not necessarily. Finally, don't let disputes among so-called experts distract you. The truth is out there, and without any reasonable doubt, the facts are on the side of liberty and individual responsibility. And don't forget, the ultimate basis for our right to keep and bear arms is not science, but principle. We have the inherent responsibility to defend ourselves and our loved ones, and we are entitled to arm ourselves with the tools that enable us to do so. Please check us out at drgo.us. If you're interested, this content will be posted there next week. So I should have asked you, said don't memorize it, there's no test after, sorry. It's all open book next week. Thank you, and God bless us, one and all. And I think someone needs to say a word of admiration for Thad. What a voice and what a presence. Now, impersonal voices, do I have any time to take questions? I'm not told no, so if you have any questions, I'll be happy to try. Yeah. There's the American, Dennis, do you remember? Physicians and surgeons. Yeah, there is one. I apologize. There is one. It's obviously it's even smaller. It doesn't have 20% of America's physicians, but they are quite conservatively oriented, strongly pro-private practice, and will take positions in opposition to some of the larger medical professions' overreaches. Well, I'll look it up afterwards if you catch me. We'll find out. Yeah. Okay. This was data dense, but that's what we do. We don't not only want to come up here and say gun rights are for the best, we want to be able to tell you why, and we want to help teach you how you can see things and analyze things when you're talking to people about what's true about it. So I hope that helps, and we are around, we are here, especially for any 2A organization, to help out in all the ways that we can, and we want to. Thank you.